Good morning to all our beautiful viewers out there. We hope you're having a great morning watching us on whatever platform you're watching us. We do hope that you're enjoying the show. We're jumping into our first segment this morning, and we're joined with representatives from BFLA and from Matron Roberts and the National AIDS Commission as we're discussing the PrEP rollout that's scheduled to happen. So joining us this morning from BFLA is Ms. Joan Burke, and from Matron Roberts is Dr. Mariana Ancona, and we'll be discussing just that, the rollout. So good morning to both of you. How are you both doing this morning?
Great, thank you.
Welcome to our couch. And I know Ms. Joan from
Before you were born.
From before I'm advanced. But good morning. Okay, so PrEP. Let's try to educate our audience as to what PrEP is.
So PrEP stands for Pre-Exposure Prophylaxis. And basically, in the simplest terms, it's using HIV medication to prevent HIV infection in people who have not yet been exposed.
Okay.
It's different from, for whatever reason, having had unprotected sex and the next day you realize that might have been an issue. This is before any of that. This is before anyone has been exposed.
Okay, and how is it not installed? How is it given in dosage? Is it a pill? Is it a injection?
It's a pill.
Okay.
And how you take it depends on what kind of sex you engage in.
Okay.
And it's a little bit more complicated than that, but it's as easy as taking a pill. It's more identifying if you should be the person taking PrEP. And basically, if you are a person who is sexually active and in the last 6 months have engaged in anal or vaginal sex, and 1, you have an HIV positive partner, 2, you inconsistently or do not use condoms with your partners, or you have had another sexually transmitted infection in the last 6 months. So those are the kinds of patients that may be able to benefit from them.
Okay, so in terms of trying to figure out what bracket I fall into, what do I need to do? Do I go to BFLA or do I go to Matron Roberts to have a questionnaire filled out or something like that?
Well, you can access any HIV-related services in almost any healthcare facility, but the specific program that's been rolling out is a pilot program.
Okay, thanks. And as Doctor said, PrEP is basically the pre-exposure.
Okay.
And for the pilot itself, we are looking at what we call the key populations because of the fact when we look at the HIV/AIDS infection profile of Belize, it basically puts a certain population at risk, which includes men who have sex with men, the trans, and then even with the discordant couples. So we are targeting those individuals.
Okay.
And as Dr. mentioned, the criteria, do you think that you're at risk? So we have PrEP on demand because you feel that you are at risk, or event PrEP. If you know, September celebration coming on, you might have Patrice Robert and everybody coming, and hey, you're going out there. Earlier you were discussing, people putting things in your drink, so you lose control, right? And so whilst we may not want as a country to encourage that as a part of the norm behavior, these are things that will be considered because you don't know what you're going to do when you get out there. So it's so we refer to that as event driven.
Okay.
So those are the selection criteria, or the primary selection criteria. So you answer those questions yourself, right? Okay, am I at risk? Why am I at risk?
Okay.
And then whether or not then PrEP is an option for me. So then when you step into either BFLA or Matron Roberts, there will be a healthcare provider that then takes you deeper down into understanding and your own assessment. As part of the project also, we have what we call peer navigators. In Belize, we'll have 15 peer navigators, 9 working with the Belize Family Life Association, and 6 working with the CSO hub.
Okay.
They will be assigned to work with in different areas like BFLA. We're covering Belize district, including the Keys and up north.
Okay.
The hub works in the the south and San Ignacio. And so the peer navigators, they go out, they do certain activities to then mobilize these individuals from what we consider these high-risk populations. So mobilize them, educate them, kind of like guide them to then decide, okay, we will then direct you to these facilities where the PrEP is going to be offered.
So they're really building that kind of relationship beforehand so that there's that
Definitely.
trust. Because when you think about PrEP and all these things, it is an uncomfortable conversation for many people to have,
It
to
is.
even accept that I put myself in risk. Possibly that something could have happened. I'm not even sure I remember the night, because that is something that happens a lot of
Right.
times for drinking. And you're there wondering, okay, what do I do next? I want to ask, because I know you were mentioning criteria, but we never mentioned anything about age. And I think that's a very important topic to tackle on a little bit too, because when we think about some of these things, we have people that are under 18 that are sexually active. So what is happening in that realm?
Well, I can speak on behalf of BFLA, and simply because we provide services from a rights-based approach, and so we are not like the ostrich, right? We don't keep our heads buried. We know what we are seeing in our
Right.
facilities, from the
Right.
fact that we can report so many teen pregnancies, so many persons under 18 who are HIV positive and have other sexually transmitted infection. We know that they are sexually active, and some of them is not by choice, right? They're being forced into it. So for us, we take all that into consideration, right? And so it's not that we're going to turn away anybody because of their age. It's an opportunity, actually, to then do more in-depth counseling and guidance for these individuals and try to empower them to a certain extent that they can make some decision, or also direct them if they feel that they want to do a report or whatever because of the situation that they're in. We prepare them to do that. In addition, we are, as Doctor said, preparing. There has been training, the facility assessment. There has been a number of things put in place before the rollout. And a part of that, we are putting in a counselor, so you can do e-counseling.
That's amazing.
Even before there's the whole process where the individual is given what we call a PrEP panel. So we do the syphilis test, we do to make sure that, yes, whilst you may not be HIV positive, but then what is their health? There are other things.
They're
So,
other sexually
right.
transmitted. You're
And
right.
not only that, we do the whole, what we call the PrEP panel, right? So it's a process.
We have a question here. They're asking, is there any side effects to PrEP, and how will that be monitored?
Well, the pill that we use for PrEP is based on good kidney function.
Right.
So it's not like you show up and you say, I want the pill, and you take it home and that's it. It involves sitting down, identifying your risks, making sure that you are not HIV positive. So you go through testing, we check that your kidney function. But the pill is actually really tolerable. The side effects from the people that have taken it with HIV seem to be minor, and they seem to disappear after 1 or 2 days, if any. But it is a matter of taking the pill and also monitoring. PrEP isn't just take the pill, because PrEP is very effective, up to 99% effective in preventing HIV if you take it the way you're supposed to. And that's where the trade-off is. We have to talk to you. We have to make sure that you are able to follow the instructions, that you are willing to take it the way it's supposed to be.
Okay.
It's not the partner who's somebody brings you, I want him to take PrEP because this is, or the parent who is like, I don't trust him. This is something that has to be done willingly. It's an autonomous thing that you have to say yes to willingly.
I think we should kind of clarify at this point that PrEP is there and it's 99%, like you
Up
said,
to 99.
up to
if-
99% effective. But that does not mean that I still don't wear a condom
No.
or other contraceptives, no? Because, I mean, there's other STDs like you were
Right.
talking about that PrEP might not be effective against.
Yeah.
Our job at the clinics is to help you identify your risks. And that means having an open, honest conversation with your patient and you being comfortable enough to tell us what your sexual preferences are, what kinds of sex you prefer, and all that. And once we help you identify those risks, we help you understand why they are risks. And then after that, to provide you tools to eliminate or at least minimize that risk, be that education, condoms, PrEP, anything to help you avoid becoming sick. We're working towards the goals of 90-90-90 in 2025, which is 90% of people that have HIV know that they have it, 90% of people that know that they have it be on medicine, and then 90% of those on medicines to be virally suppressed. The medicines we have now with HIV, once you're on them, if you take them the way you're supposed to, by 6 months maximum, you're supposed to be virally suppressed to where you cannot pass on HIV to another person. But just like you said, that doesn't encompass syphilis, chlamydia, gonorrhea, and all other things. But we have to work at all angles and give you all tools to prevent risk.
So I want to be devil's advocate a little bit here. Because you know how sometimes society starts to look at something good and then find all the flaws with it at times. So looking at PrEP and the fact that, it can be up to 99% effective, how do you feel, or can you explain or justify, or I would say, just explain the idea or the thought that people might have and say that, well, because of PrEP now, people can behave a little bit more wild, or like they might not care and they're more riskier behavior because they know they have that backup for PrEP. And I feel like that is something where a lot of people might come and say like, oh, this is just opening the door for people to just like live their best life and not worry because they know they have that backup that will be able to help them.
No, that's why it is very, very important, especially for the key population and the relationship that they have with our peer navigators as well as your healthcare provider. Okay. And it's not only for HIV. We look at diabetic patients, right? And you have diabetics who feel like, oh, you know what, now once I take my medication, I could still eat as much cake as I want. I could still eat whatever. It requires that personal relationship with your healthcare provider, and then also your personal responsibility that you take for your own health and well-being, so true. Right? Because yes, whilst we have PrEP, we have other services, at the end of the day, what you have, your own personal responsibility, your commitment to yourself is to modify your behavior, right? Because healthcare providers can only do so much.
Yes.
Exactly.
I remember the great Dr. Bulwer, he wrote this book and he said, your doctor can't make you well, right? Your service provider can only give you so much. Because even with ensuring that you're fit for it, like I mentioned earlier, the PrEP panel, which includes, the syphilis test, the hepatitis B and C, and the creatinine, all that, those are services that are being provided to make sure that you're PrEP ready.
Yeah.
Okay.
But when you get it, then you have that personal responsibility to make sure that you stay HIV negative.
So I want to talk now about the collaboration between NAC, BFLA, and Matron Roberts. How did that come about in terms of the rollout of PrEP?
Okay, just for clarity, the National AIDS Commission is comprised of many partners.
Okay.
Ministry of Health and Wellness, the Belize Family Life Association, you have the church, you have other civil society organizations. And so the NAC Secretariat, which Mr. Romero, who unfortunately could not join us, he's the executive director. So the NAC is a number of persons, number of organizations that make up the NAC. There's a national plan to respond to HIV and AIDS in Belize. And so there are a number of partners. The doctor mentioned about the 90-90-90. And so that's part of our responsibility as members of the NAC. What I want to say here is that the whole rollout for PrEP has provided an opportunity for us to do even greater partnership, particularly with the private sector. Because as we talk about ensuring that persons are PrEP ready. And because we want to make sure that the individual is the center, that we now have to engage the private laboratories in the districts to make sure that the person can go and get his or her VDRA, get the pregnancy test, get the hepatitis. And we believe that the more persons we bring on board for the national response, eventually when we no longer have access to Global Fund, for example, which is the entity that provides quite a bit of funding to the country to respond to HIV, it would have already been integrated into our national healthcare system. Right, so this really provided an opportunity for us to engage the private sector and other partners as well.
I can clearly see how, you know, from just this one situation, well, actually, it's been something long time coming, because Kevin was talking about it. I know you guys mentioned, you know, this is not just we wake up one day and say, oh, well, apply PrEP. It's not like that, you know. It's been quite a process that was planned. I want to ask, because it starts July 1st, and you've mentioned, you know, events and everything specific. So how long will this pilot start? And, you know, we already mentioned the vulnerable groups, and so what can people look forward to? I know there's the peers that they can be able to access and so forth, but for people maybe that didn't say the peers, can they just visit, you know, Matron Roberts, visit BFLA? How can they be able to access information to us? Well, because they may be thinking, I can apply, I qualify. How long will it roll out that I can be able to access PrEP?
Not because you're not or you identify with any one of these groups or based on your sexual orientation that you're not eligible, right? What we want is eventually for the nation to embrace PrEP. And so once an individual steps into any one of the, whether BFLA or Matron Roberts during the pilot, it's not that you're going to be turned away. Right? What we would really want to see is that the same efforts that will be given in terms of the education being done by those who are being referred through the peer navigators, that same effort and everything will be done. Because from the fact that you step into a facility requesting PrEP, you have already done some kind of assessment of your risk. Right? And so we want to make sure that we do not set policies and procedures in place that will eliminate anybody. Right? So that is a whole plan, that even if you come in, then you will be able to be directed.
I think that's super important, that no one's left behind. Yes, Doc?
But remember also, this is PrEP, but everyone at least once a year should step into a clinic, check themselves out, and sexual health is one of the categories in the spectrum of a general checkup. We need to make sure you do things like, are you protecting yourself? Are you at risk? You need to be tested. Have you had a pap smear if you're a woman? All of these things. So sexual health is something that we need to start taking into consideration as a norm.
Well, I think that's so true.
I think so. Well, I know people will probably be asking this. How much would it cost to actually take PrEP? Is there any cost to going in clinics or?
No.
It's free.
No, right. Because I must say here that even as I mentioned, that we will be collaborating with the private sector under the Global Fund, where we are piloting this. These services will be paid for. The Ministry of Health, in terms of all the different supplies and all that, is providing. So it's free to the beneficiary. There's a cost, but it's free to the beneficiary.
Great.
So y'all cover that cost.
The government of Belize through Ministry of Health, and then of course as we have Global Fund. And I want to say this, that the piloting of PrEP is not only for Belize, that we have, it has been done in Guyana with great success. We have Barbados and other countries in the region that are basically participating in this regional initiative for PrEP. We have the PANCAP, who has been very much behind it. The Pan American Health Organization has been very much behind it, because we had to develop guidelines and protocols and making sure that all those who are involved, all the clinicians and everybody be involved and ready. because it's not just to just jump up one day and say, hey, we want to be a part of PrEP.
Yeah.
No, it's a process of preparation. And even with the pilot, like any pilot, it's basically for us to go back to the drawing board at the end of the pilot to determine what worked, what didn't work, what we need to do here, what we need to do there. So,
Right.
It's a process for us.
Doc, I want to ask in regards to the intake of PrEP. I know we talked about, if you have to kind of evaluate your situation, the circumstances. What happens in case like you have to take it multiple times? Or is it a case where you have to take it multiple times if you decided to get sexually active with somebody, that can possibly have HIV? Like what is that process like too as well?
So there's two modalities to taking PrEP. It's event-driven, like Ms. Burke said, and there's daily PrEP.
Okay.
So for the person that is engaging in, specifically men who have sex with men who are engaging in anal sex, then they have the benefit of being able to do event-driven PrEP. And basically that's being able to plan sex, being able to take the pill 2 to 24 hours before it starts, and then taking it one 24 hours later, and then the other one 24 hours after that second dose. Now, that requires planning, that requires a specific sequence of events, but there's also the daily PrEP. So if you're having sex more than twice a week, then it makes sense to just do daily PrEP.
Okay.
So you can do that. And that's also for serodiscordant couples. So couples in which one is positive, one is negative, or persons that have multiple partners and are not aware of their status or are not using barrier protection. So there's that. But like I said from the beginning, the process is a little bit lengthy in the beginning because we have to sit down, we have to talk, we have to do testing, then we have to start, then we have to test again.
Yeah.
So it's a matter of keeping track if you remain HIV negative, because if you don't, then we have to switch to treatment. But again, it is very, very effective if you take it exactly how you're supposed to.
And then, I think it's super important that, you go through all the criteria, like you have the honest conversation. And people, please don't lie to your healthcare professionals. Be honest, they really not care about your business like that. They just want to make sure that you're okay. Because I've had people where I know where I said, I don't want to tell she my business. Like, they ask too much things. Tell her your business. Because trust me, they've probably heard the craziest stories.
It is not my job to judge what my patient likes to do with other consenting adults in the privacy of his or her bedroom. It is my job to help you stay safe. And the only way I can do that is if I know what your risks are.
Perfect. See? Exactly.
Confidentiality goes a long way. I mean, from my profession alone, once persons realize that, okay, this is just between us, I find them opening a lot more. Right.
But that's good, though. That's important. We need to be able to have that. And so I think right now, it's July 1st, we're rolling out the pilot project. It's really important that you can start to have these conversations, find out all the information. Like you mentioned, it's a lengthy process when it comes to testing and so forth. So I think mentally you start to get ready and seeing if that is something that you qualify for. And you also mentioned something really important, Ms. Burke, is that even although we're having this specific group of vulnerable persons, it's still open to any person that feels that they do need to take it too as well. And again, the process will be you have to have the conversation with your healthcare professionals, get the needed information. Don't just wake up and say, I will take it. No, it does not work like that. We have to be able to dive deeper, understand and dissect the situation to see if you qualify and all these different things.
And from yesterday's show, we've seen that carnival season is in effect.
Right.
So
we have the launch right this Saturday.
Definitely event-driven.
Right. And even though they're not a part of the target population for this pilot, a number of persons, particularly women, who live in very abusive relationships, right? Victims of gender-based violence where they know that their partner have multiple partners. They feel powerless to do anything. And sometimes we know of instances where many women are being raped by their partners day after day, night after night. That person is at great risk.
Yes.
Because she has no control over the decision making, when to have sex, when not to have sex. So persons who find themselves in that kind of situation may want to think about it as well.
On that same note, Ms. Burke, and it's just something that popped in my head, in that incident where maybe you also may not have access to actually leave your home, is there anywhere that maybe they can contact Matron Roberts or BFLA for any of the different civil agents from NAC and say, can you guys come or maybe arrange some meeting or something? Because if you can't leave your house or, you're being monitored, is that something that is available to as well?
That is definitely something we at BFLA want to look at, and especially now that we will have the counselor and you can do the e-counseling.
Okay,
right?
great.
Because we found that when we had the lockdown during COVID, we had a counselor on board to do e-counseling, and you'd be surprised as to the calls that she received. Like women like them, I mean, they had to be going into the bathroom and try to quickly hold the texts and all that. So whilst, yes, we're looking at the key populations, and that for us at BFLA, we're looking at the wider population and pockets of the population who we know are at risk.
You said right-spaced.
Exactly.
Right. Okay, great.
So
that is a very interesting perspective there.
Yeah, I think it's super important because there's some people that maybe want to access it and they can't leave.
They can't.
And I think that's an important conversation.
And there are many ways, because I can say, like, for example, BFLA, I mean, sometimes we had to put in, I could think that the vitamin you take and that kind of thing. So for us, we think about those who we serve.
Yeah.
Right? And we try to always think outside the box. And so even though persons may not fit under one particular project, we also look and see other opportunities and meet the needs of those who we serve.
Definitely. And I feel like this is going to really take off. People are going to be able to find that information. So it's great to have the conversation, or maybe have the conversation with somebody you think does need to be able to qualify for PrEP. It's great that we start these important informed conversations, guys. So if nothing else, make it be something you research a little bit about, ask some questions about, and then maybe go in and see, okay, maybe I need to have a deeper, intake with my doctors or so forth. But don't think that, it's a very icky conversation. It's something you don't want. Let's put that aside, because your health is super important. Like Doc said, we don't care about your business like that. We're just worrying about your well-being, your health. That is their main priority. And so with that, let it be your priority too as well. Not to worry about any fake gossip or all these things. It does not matter. They're trying to protect you so you can be able to contribute to society.
And I also want to encourage, have the conversation with your partner or partners.
Right.
I think too often we just jump into, hey, let's all have fun, and for us fun, that's, sex are fun, and then
true.
later on we say, uh-oh, what happened there? So they build that level of confidence. If you feel confident with this individual, to have sex, then you're supposed to be or
able
feel
to
confident.
have the talk.
Exactly.
But you have the status quo as well.
Exactly,
Take a test, make I know what happened.
Exactly. And don't feel that, if I say, I think that you need to do the test, I will do my test too, but I want to know your status.
Right.
And if that person doesn't want, then you decide whether or not, if this is the individual that you want to have sex with.
Indeed.
So that's the kind of, as we talk about doing the education and the empowerment of individuals, that we get you to that point where you could, hey, you may get your test, make we go do this test together, kind of thing.
That is true. Make it a date, guys.
Yes, definitely.
Yeah.
And that's a healthy date too.
Our first date is at the clinic.
There we go. See that?
I actually really like that. I feel like people should apply that. Like, I don't know why people look at getting tested as these, having these conversations as something so uncomfortable and icky. Like, it's so informed, it's so important.
I think it's just the fear of knowing. But once you know, that is the power.
Exactly.
Yeah, because you could be able to, make the different adjustments that you need to make, and that's important. So also for people that or have HIV or whatever it is, they should be having those conversations with people so they could know, because you'd have left somebody, under the bus in that kind of way too.
Like you said, Doc, once you are on the medications and after 6 months and you're virally suppressed, hey, let's go.
I always say that treating HIV is a lot easier than treating diabetes, because it's as simple as taking your medicine and doing your tests, whereas diabetes involves a whole lifestyle change in terms of what you eat. And we as Belizeans, we're very tied to what we eat.
Yes.
Of course, that's part of my essence. But I know Kevin was saying, the thing about PrEP that he loves is just like, it's a prevention. because after that, getting into the realm of HIV, that is a lifelong commitment of medication, for all these different things. So you can't you're stuck with that forever. But if you can be able to prevent it, that is the most important thing that you need to be thinking about. So don't worry about the icky conversations. It does not matter. Let those conversations, guide you to how.
Through worse conversations.
Exactly. And come on, guys. If nothing else, so July 1st, I believe people are going to start seeing the peers out and everything, and they can have the conversations. Can they have it ahead of time now, just maybe to ask 1 or 2 questions just to see what's happening?
Of course, you could call in and just get the information.
General checkups, sexual health, and the conception is that when you go to clinic, it's because you have a problem, but it's also about getting questions answered. I always tell my younger patients, if you have questions about sex, about how contraception works, or what's best for you, you can come in and do that too. So if you think you might need it or you can benefit from it, it's as easy as walking in. This is a big collaboration with international, local partners, clinics, healthcare professionals. And the only way you're not going to benefit from it is if you don't access it.
That is so true.
And it's there.
It's free.
And it's free.
I mean, it costs for somebody else, but free for we.
Yeah.
We know Prophet like free things, so
they like free.
let's get out
And in
there
this way, they actually need free things too as well. So, have those conversations about sex. Have those conversations about PrEP. Go in for your normal checkup and say, Doc, you think I qualify for PrEP? Like, if you want to see secret, and then continue, and then you go into those conversations afterwards. But again, it's out there. Well, it's going to be out there July 1st. So let's see if we can access it, if it's necessary for us. But have these conversations. Don't hold back. Don't hide under a rock. And also, if you do want to access it, but can't mobilize yourself, also have those conversations as well to see how you can be able to get that provided for you. Because all of that, nobody to get left behind. It's very inclusive. And we're going to have a holistic approach to this.
And we have so many different things to worry about in life. And so PrEP can help you. HIV is one less thing to worry about. I know one something, so.
Yeah. Love it. So thank you so much, ladies, for being here. We truly appreciate this conversation. And I feel like it's very insightful in many ways that people can understand, where they stand, but also the important conversations that they need to have. And they don't say they open up for guys. All of the bombarded questions, they're ready for it. They're ready for you to go and stop by. Remember to get your checkup, though. Please get your checkup. It's one checkup for the year if you need to have more than that or whatever it is. But know your status. It's super important to be aware of where you stand, guys. Don't run away from it. Embrace it because, like Brandon said, it is your power to know where you stand. And so with that, we stand with our next commercial break. And when we're back, we're going to be talking to Full Circle Belize on the recycling projects underway. So we're keeping healthy, guys. And so stay tuned for that exciting conversation. Let's see how you can be a part. We'll be right back.